Thank you for staying with us. It is still the conversation here on Lagos Television, and on this side we are discussing World Sight Day. Now this is usually celebrated October 9, which is tomorrow, but we are taking a focus, we are taking a look at this topic today here on the conversation. This year's theme is Love Your Eyes, and personally for me, when I saw the theme, it was more like a call to action, you know, an awareness for us to really pay attention to this organ that we have here, the eyes. And joining us to shed more light on this important topic is Dr. Ufoma Olumodiji. She is a consultant ophthalmologist at the Lagos University Teaching Hospital, Luth. You're welcome.
Thank you so much.
So starting from the theme for this year's commemoration, if I may put it that way, it says love your eyes. For you, as one who is in this field, what does this mean?
Okay, so the eye I would want to begin is, first of all, the organ of sight. And it's interesting to know that as small as it is compared to every other organ in the body, the tendency is to overlook its importance. So in emphasizing on the importance of the eye, the body in itself cannot function optimally without the eye being in a good condition. So that is why, as globally, we are emphasizing the importance that as much as the eye is small as an organ, we must love the eyes so that the body can function optimally. So that's the emphasis of the World Sight Day, and interestingly, the theme is same almost every year, though the emphasis may shift, but the theme still is love your eyes.
All right, so you said something now that we tend to focus more on other parts of our bodies and less attention on the eye. So why do you think this happens?
Okay, so I would want to share that if we talk about size or any other part of the body not functioning, the tendency is to say, oh, I have a headache. And then everybody just feels like, oh, the headache is so bad, and they just feel like, oh, it's the headache. But I have an eye pain, but I feel like, oh, it's not as bad as the headache, so I can just keep managing myself. And probably until it becomes unbearable, I can't see anymore, that's when they feel like, oh, let's give it a bit of an attention, because the eye is small. If I have a stomach upset, I feel like, oh, something big is happening to me. But I have an eye itch, or the eye is red, I just feel like, oh, maybe I didn't sleep well. It's not something that bad. But the importance is that the eye is small in its size, but its function cannot be overemphasized, because even if the body is good and fine, if the eye isn't working, the whole body stays back at home, because the body cannot see how to move and function.
All right, let's talk about some of the most common eye conditions that are prevalent here in Nigeria.
Yes, thank you. So in Nigeria, being a developing country, some conditions that are very prevalent and saddening, preventable, they lead to blindness that can't be preventable. Common is cataract. Now, cataract is the commonest cause of blindness. And then glaucoma. We have other conditions like refractive error. We have conditions like age-related macular degeneration, amidst many others. But why it's of importance in Nigeria is that some of these conditions are actually preventable and treatable. And we have a large number of our population, as much as 70 to 90% amongst those who are older than 40 years, living with this kind of blindness in this part of the world. Meanwhile, in other parts of the world where they are much more developed, we may have things like maybe diabetic retinopathy, hypertensive retinopathy, because those are conditions that are secondary to other systemic conditions. That's conditions that affect the entire body. But in this side of the world, common diseases like cataracts, which is the opacity of the lens, glaucoma, a lot of people are living at home blind because of these conditions, mostly because of lack of awareness and lack of access to good eye care.
I'd like you to really dwell on these conditions and speak about them a bit, glaucoma, cataract.
Thank you. So cataract is a condition wherein we have the lens of the eye Now, the lens of the eye, when we're born, the lens of the eye is clear, it's crystalline. We can see through it. Now, as we age, this lens, which is clear, becomes opaque. In the layman's language, it becomes white. Now, we have a few exceptions of children who are actually born with cataracts, or people who in the course of their lifetime had trauma to the eye, or probably had other conditions that led to this cataract. But majority of the people who have cataracts, it occurs secondary to just getting old. Like, would get old and the hair will become gray and white, which we don't feel is a problem. That's also the same way as we grow old, the lens also becomes white. Now, becoming white isn't a problem in itself, but not knowing that this lens is white, I am going blind and I should access care and have a surgery done wherein this white lens is taken away and then a clear lens is put in to replace the white lens that has been taken away, and then vision is restored almost back to normal, if possible back to normal, where a good surgery is done. Now, that's for cataracts. I would come back to cataract, but let me talk a little about glaucoma. Now, glaucoma on the other end is quite a dreaded condition in the eye world, mainly because it causes a kind of blindness that is not reversible. Now, when vision is lost, it's lost permanently. And glaucoma is a condition, we call it in our own term, we call it the thief of sight. What that means is that it claims the vision of people without them knowing. By the time they're beginning to realize that the vision is going, it's almost late.
So there are no signs that you can hold on to?
Now, the way it takes the vision is this. The person is seeing clearly. Ahead, everywhere is clear, but it takes the vision from the side. So it causes a peripheral visual loss. So the vision starts declining from the extremes. And by the time the person notices that, oh, I'm not seeing well, by then it's already an advanced condition and it's irreversible. Now, in this state, the fear is this. So what do? Everybody who sees well, I don't have a problem with my eyes, go for an eye check. It's like people who have hypertension. They really don't feel any sign. By the time they start having signs that, oh, there's a way I'm feeling, I'm beginning to have palpitation, my chest is beating so much, I'm beginning to feel too tired. At that point, there are already systemic end organ damages that have occurred because the hypertension has been prolonged. Now, same with the eye pressure. Now, glaucoma is a condition wherein the pressure in the eye becomes so high and then it causes death of the optic nerve. So the optic nerve, which connects the eyeball to the brain and enables the eye to be able to see, because eventually it's the brain that sees, but the eye connects the eye is connected to the brain through the optic nerve. So once this pressure in the eye becomes so high, it compresses on this nerve and causes a death. Now, cataract in itself, once surgery is done, vision is restored. But glaucoma, once vision is lost, even with surgery, vision is not restored. So we hear people who go around and say, use this drug, you use it for 3 days, you'll start seeing again.
Eye drop.
Yes. So interestingly, yes, eye drop is recommended for glaucoma, but it's actually just to control the pressure. So there's the use of eye drops, there are the use of doing laser. Surgery is also done to control the pressure, but it is better when it is detected much earlier, wherein all of these works and the vision is still preserved. But once vision is lost, even with doing all of these, vision cannot be restored. So those are common things. Other conditions that are very important also, like refractive errors. We have some children that are born and the vision is so low, but you know, when a child is born, the child really can't tell the mom, I can't see that far, I can't see this near. But you know, I would want to even educate the masses. I see you have a child at home and you notice you put on the TV and the child always wants to go right in front of the TV. That points to something this child cannot see. So in class, everybody is copying the notes and the child is not copying. And instead of saying, why don't you want to copy the notes? Ask this child can't see the board. So in that case, wherein a child is born with poor vision, the best thing to do is to have a glasses test done. Having checked every other thing to be sure that there are no other causes of that decline in vision. And then if the child needs to use spectacles, it's given. Now, if spectacles is not given much earlier as it's required, the eye becomes lazy. In our term, we call it amblyopia. What that means is that by the time this child has grown, not seeing clearly, the eye assumes that state. Now, the brain just assumes that that's how blurry the world is. And then it remains like that, such that as the child grows up, you give it glasses eventually, it still can't improve the vision. So these are common conditions that a lot of people are living with. They don't know. And by the time they are realizing, even the ophthalmologist can't do so much.
So you've established that some people begin to have eye issues as they age. Now, how do one differentiate between having the normal eye issue and then eye issue that comes with aging?
Okay, thank you. So some of the conditions that occur with aging, like I've established, is cataracts. Glaucoma also is more prevalent amongst those who are aging now, as from 40 years and above. Tendency to develop primary open angle glaucoma. Then there's what we call presbyopia, where you can read your prints very well. You can read tiny prints, but just realize as you're growing older, I can't see this so well. Now, how to differentiate that this decline in vision is secondary to age or there's actually a problem is this. The person who has an age-related problem would not have a problem with vision all through life until the person gets to that age. Now, there are age limits to these conditions. Now, those who have what we call presbyopia, they would be able to read and see everything well until they start getting towards age 40. Then they start telling you, oh, I need to increase the font of my phone before I can see clearly. Then you know, oh, this is age-related, it's presbyopia. Or you have a mom or a dad at home who actually can drive so well, even drive in the nines. And he starts telling you things like, oh, when I drive, the lights from the oncoming vehicle, you know, hear things like, it blinds me. You know that, oh, this is age-related, he has cataracts. Or you hear people say things like, when I drive, I don't need to turn to see my side mirror. But then it starts telling you things like, before I can see my side mirror, I turn completely. That means there's loss of peripheral vision. So those persons prior to that age, they didn't have a problem at all with vision. So by the time they start having those complaints, it points to the fact that, oh, it's likely age-related eye conditions are beginning to set in. Not also to forget age-related macular degeneration. Now, this is a condition wherein, with aging, there are other risk factors that can actually precipitate it. But with aging, you just hear things like, when I look at a person, I see the body, but I don't see the face. You know, oh, there's a problem with this macula. So this points to the fact that, oh, these are age-related conditions that are beginning to set in that individual.
Okay, still talking about the eyes now. So I think I saw a video where someone was saying, how do you know your eyes are healthy? When a light flashes and then you close your eyes, you still see flashes of, I don't know how he puts it, or something. So I need you to clarify, but do you get what I'm saying?
I get it.
So I need you to clarify that as well.
Okay, thank you. So in the ophthalmology world, we have what we call ectopic phenomenon. Now, these are, I will call them they are images that we see. They are not real in themselves. But you shut the eyes and all, and then you see like, oh, there are a bit of some things in there. Now, there is a pathological part, but I'm trying to explain the normal, wherein there's no problem, but we see these things and we know, oh, we shouldn't be worried. You shut the eyes and then we see these are images that are formed by the blood vessels, the movements of blood in the blood vessels in the eye. Now, that's one. But there are actually some things that we can see that will point to the fact that there is a problem. There's what we call floaters and flashes of lights. What that means is that there is nothing floating. There is no light flashing. But then you shut the eyes and you see lights flashing like, you know, like thunder sparks in the eye. It's a problem. So it actually doesn't point to the fact that the eye is very healthy. Okay. So there actually could be signs of vitreous detachment, posterior vitreous detachment. It could also point to the fact that there may be a retinal detachment occurring. So seeing floaters, seeing flashes of lights, it occurs with aging too. But it points to the fact that that's a warning sign to go see an ophthalmologist and get a proper eye check done, because it could just be saving the person's vision.
So let's talk, still talking about our eyes now. How important is it for one to go for regular eye checks, even though you do not have or you're not predisposed to eye problems? And then, okay, let's answer that first.
Okay, thank you. So how important is it? Sincerely, if I could overemphasize it,
Because
I
we don't
would.
see it as normal.
Yes,
Yeah.
true, very true. On this side of the world, we actually don't see it as normal. In fact, everybody feels like if your eyes are fine, you don't have a problem, why bother yourself?
We don't go to check our eyes. We don't go to the dentist.
True, very true. I don't know how to drive this point, but it cannot be overemphasized. Truth. It cannot be overemphasized. You don't have a problem with the eye, just check. You may just be saving yourself from something you don't know. So in ophthalmology, we recommend an annual eye check. For children, in fact, as we get older, it should be more frequent. There's no issue, go for an annual eye check. In fact, I recommend that children during long vacation, you know, they have their long vacation once every year. Just take them around. The same way we would encourage everybody to have a total body checkup annually. That's the same way we should have the eyes checked annually. Now, let me also strike a balance here. That when I say have an eye checkup, I'm not talking about just going to do an eyeglass test. It's much more than that. So you check what you can see. So you look at the Snelling chart, you read and you say, oh, this is what I can see. I can see a 6.6, I can see a 6.5, or I can see a 6.60. Okay, I do a glasses test and I say, what can that improve me to? Having done that, check the intraocular pressure. Because if I do an eyeglass test and I walk home saying that, oh, I can see a 6.5, meanwhile, the pressure is higher than it should be. That means that person has glaucoma that has not been diagnosed. So even checking the pressure and it's normal, it also doesn't end there. You have to do a fundoscopy. Look at the optic nerve. What's the picture like? Oh, is this a glaucoma suspect? Or is the optic disc normal as it should be? Having done that, and then once the person is declared good and fine, that also doesn't exclude the person from further eye checks. That the person has been declared good and fine this year. By the same time next year, go do another eye check. Good and fine. Go subsequently, annually, just get the eyes checked. And then in families where peradventure someone was just very careful in having an eye check done and the person was diagnosed of having glaucoma, that person becomes a contact tracer to every member of the family because glaucoma is an hereditary condition. So a member of the family has it, everybody becomes a suspect. In fact, onto the children, everybody just has to go have their eyes checked. So while eye check is recommended for everyone, in fact, it is extremely important for people who have family conditions running in them.
How affordable are these eye tests if one must go with your entire family, considering the economic condition?
Oh, yes. So, yes, I know the economy isn't that good. But I think in this situation, while we have the low-income earners, middle-income earners, and the high-income earners, I think healthcare in Lagos State has been quite accessible and affordable, which is the aim of part of the World Sight Day, part of the aims of World Sight Day that we're emphasizing. Now, in Lagos State, for instance, we have the primary health care centers, and to the best of my knowledge, in the primary health care centers, we actually have the eye clinic fractions in them. And it's quite accessible to the population, even to the low-income earners. And I know that they actually have their eye checks checked at free to almost no cost, very little to no cost. Then we have the general hospitals. I work in Lagos State Teaching Hospital, but we have the general hospitals in almost all the local government areas, and it's also accessible. Yes, I know it can be quite hectic, considering the crowd and the turnover of patients, but I know it's actually quite affordable. And for the high-income earners that may not want to have to queue and go through the hassle, we actually have good eye care private services that are affordable and accessible.
Still talking about loving your eyes, let's talk about some lifestyle that are dangerous or are harmful to the eyes.
Very important. So loving your eyes, I would want to start from the entire body. Now, in ophthalmology, we would call the eye the mirror of the body. What that means is that you look at your eyes and it gives a true picture of the state of the body. If the body is healthy, I see it in your eyes. But if the body is not healthy, in fact, when I look into your eyes, I can tell if you're a diabetic patient, actually, because the eye is the mirror of the body. So some of the practices that would help keep this eye healthy, lifestyle practices, I would say whatsoever keeps the body healthy actually would keep the eye healthy. If exercise will keep me healthy, it will keep the eye healthy. If eating healthy diets would keep me healthy, it keeps the eye healthy. So I would say live healthy, eat healthy, stay healthy. Now, some of the practices that are harmful to the eye, I would want to come from the populace and go up. Now, there's what they call harmful traditional practices. These are practices that have been passed down to us by our fathers. You know, in their own time, they didn't have good healthcare services. So everything was more about trying out things, you know, just trying to make things work. And probably, maybe they did it 1 or 2 times, it worked. And then they endorsed it, that when you have this, use this. Let me give you practical examples. So you hear things like, if you have a baby and the baby has discharge coming from the eye, just put breast milk. The breast milk would clear it up. Or you hear things like, if your eyes are red, in the layman's language, you have Apollo, put your early morning urine, like to make the eye good. You hear people say things like, put onion water. You hear things like, put battery water. Yes. So we don't know how many people had to try it for them to be able to recommend it. But these are practices that, I tell you the truth, they are still doing them on the streets. And as they are doing them on the streets, it's also blinding a lot of people out of ignorance. Now, these are things that are not recommended. In fact, up until today is Wednesday, that was last week Thursday, I still met a mother who brought her baby for screening. And then she asked me something. She said, can I still continue with the breast milk? I looked at her straight in the eye and I said, you're putting breast milk in this baby's eye. And she looked at me so ignorant and she said, yes, doctor. My mother-in-law said I should use this, and I said, I beg you, this baby is too innocent. Don't do this to this child. So I would want to say that these are harmful practices, extremely harmful. In fact, too harmful, too harmful. Sometimes when we have victims come to the clinic, we tell them, go and become ambassadors. Go back to who told you to do it. Show the person your eyes. See what you've done. Go on your street. Tell people, don't put onion water. It has blinded me. So these are things that are not recommended, and they are very harmful to the eyes.
I'd like to also talk about the use of contact lenses. And so while I was in school, I schooled in the East in Enugu at a point, I heard the story of a girl who was fixing lashes and then the glue got into her eyes and then she became blind, you know. And that day I said, I cannot fix lashes, you know. So let's talk about contact lens. How safe is it?
Thank you. So I would want to say it's good to look good. Let me start from there so that there are no bias. There's no bias. It's good to look good. But I would want to say in looking good, there are some caveats that we should not dabble into if we are not able to do it properly. Now, contact lens in itself can be recommended as part of eye care. Now, there are different uses of contact lens. Some people, instead of using spectacles, they would opt to use contact lens. So they don't need to wear glasses like I'm doing. They just fit it in and they can see clearly. You can also use it as like a tattoo to cover those who have corneal opacities. But the ones we see quite commonly is more of the fashion. Now, the fashion of, oh, I don't like how my eyes are black the way God made it. I like it to be have a little tint of blue. Yeah, you understand. So, and then the person fitting it in on the streets, we don't know how clean the hands are. You know, they have to apply some chemicals. And in looking good, we have to live with more complicated issues. I would want to advise the public that it's good to look good, but in doing it, let's do things rightly. Contact lens can be used when used properly, but the ones done on the streets, I can assure you, it's not being done properly.
So let's talk about some fruits or vegetables or foods that can also aid eye health. I know they say onions is good for the eye, carrots.
Yes. Yes, so there are actually some vitamins that, while it's good for the body.
Is it raw onions or cooked onions?
Mm.
So no.
In fact, the one I heard before I entered into ophthalmology is while you're cutting the onion, in fact, the water is coming out of your eyes, cleaning your eyes.
Yeah.
You know, I also heard things like that. But I would want to start by saying that, well, some diets are, in fact, good diet is good for the body. There are some that are actually very much like the eye benefits from it quite as much as the body does, or even much more. Now, vitamin A is very good for sight, and we know that there are some vegetables that actually they are high in vitamin A, like the carrots. Now, that's very good for the eyes. Now, we're taking it because we want to keep the eye healthy and also the body healthy. Now, all these very colorful...
Do we cook our carrots or eat it raw?
Now, it can be eaten raw, even if it should be cooked, not overcooked. Because in overcooking it, we have killed the vitamins in it. Now, very colorful vegetables, like these green vegetables, they are very high in what we call carotene. So, like these colored peppers, like the green pepper, the red pepper, the yellow peppers, they are high in carotene, and carotene has been scientifically proven to be very, very good for the eyes. So, in keeping the eye healthy, we can actually measure on those kind of diets.
Okay, so let's talk about screen time now. How do prolonged screen time from our phones, computers affect our eye, especially for children? Right? You see every child now with their tablets.
Thank you. So, yes, screen time. Now, I would want to talk about it from two different angles. Talking about screen time, when we talk about the amount of time we spend looking at the screen. Now, we have a lot of children who have became myopic, not because they were born myopic. Some were born myopic, but the myopia worsened because they had very high screen time. Now, in viewing screen time, you view it most time at a very short distance. And in doing that, it trains the eye to keep seeing things at short distance. So after a while, in looking at things far, they become quite blurry. And then the eye just takes that state of, you see things brightly at close distance. Now that's on one angle. The other angle is the blue rays that come into our eyes when we use these screens. And I would want to say that in ophthalmology, there's what we call the 20-20-20 rule. What that means is that we recommend it for those who are short-sighted and for children who are prone to having very high screen times. What that means is that after viewing your screen at every 20 minutes, not even just screen, even near work, at every 20 minutes, take a 20-second break and look 20 feet. So even for the adults that work a lot on their system and all, it's like a eye hygiene thing. So you've walked a lot, you've walked like 20 minutes, just take a 20-second break and just look ahead. It gives the eye the opportunity to see far and then continue with the walk. Now for children who are, let me use the word addicted with a little bit of carefulness to having screens, I would want to speak to their parents. While tablets, phones, they can be quite educative, and then sometimes it can also help keep the children busy.
Yeah.
So that the daddies and the mommies can have their space. I would want to say that some control would actually do some good. Please put some screen time to it. If you can say, okay, 2 hours in a day, it's fair. You go to school, you come back, you've done your assignments, your screen time is 2 hours. If I sit down with the child, if the child can understand, and let's agree, how many hours? 2 hours. During holidays, you can have 3 hours, or during school time, school period, we have 1 hour. But put a tag, put a limit to it. Don't let the child just, because eventually the child comes and they tell you that in class the child can't see the board, and after a while the child starts using spectacles, and then the myopia keeps progressing and progressing and progressing, and becomes much more than we bargained for.
Also, still talking about the screen now, for me, I can't use the screen when the light is so bright. I have to turn it up. But I see people who it has to be very bright, and I'm like, is this not affecting your eyes? So is that right for the light to be so bright?
Okay, so people are quite different. There are people who actually have photophobia. Like, that's how they are.
Is that a problem? The photophobia?
Now,
okay.
It may not be, it is a problem in itself. Like when people have photophobia, there are people who actually cannot cope with bright lights on their phone, even the lighting in the house, they have to make it dim, because once the light is too much, they start having headaches. So it's a problem in itself. And the solution to that is go have a photochromic spectacle. So you put on the spectacle, it dims and becomes like a sunshade and all. So I would say it differs and it varies with individuals. While I may not be able to cope with the full light on my phone, some people may be able to cope with it, and it's quite fine with them.
And it's not harmful to the eye?
No, it's not.
Oh, okay.
As long as they are not having eye ache, tearing, or the other issues that may come with the excessive lights.
Okay, I'll stop fighting people who... Okay, let's talk about schools now, especially the primary schools. You know, we have the children who cannot really express themselves. How important is it for them to also be aware when a child is beginning to have issues with the sight?
Yes. So I would want to speak about this, talking about the school eye health program. Like we have said, most children may not be able to express themselves to say, oh, I can't see. So they just sit back and you realize the child isn't doing quite well in school. And we assume that the child is dull. Meanwhile, that child actually doesn't see the board. Now, how do we engulf them and make them part of this Love Your Eyes campaign that we are doing presently? So there's what they call the school eye health program. What that's mean is that, so there's meant to be like a program that brings in children in school. So even though the parent may not be careful enough to notice it or bring that child for routine screening, because that child is in school, once every year, every child in school should be screened. Now, there should be advocacy. It's part of what we are doing, advocating that, okay, the government can come up with a school eye health program wherein different schools they allocate them to some hospitals and say, okay, this hospital, you're responsible for this government school, this government school. So on maybe the 4th week on the term, we just gather the children, check what they can read, and just check their eyes. So for children in schools, it is a school eye health program that would be able to actually catch them early, knowing that they can't see. And let me also say this, even for teachers, we have had quite a number of children, their parents brought them to the hospital, and interestingly, it was their teachers that noticed they couldn't see. The parents came with a complaint saying, the teacher said. So even for the teachers, becoming very observant, paying keen attention to every child in the school would actually be helpful in detecting some children that can see.
So to help parents to be more intentional, what are the signs of visual impairments in their kids that they would be able to notice and nip in the bud?
So let me start from when they are very much little. So some children can be born with cataracts. What that means is that you look at the child's eye, and this eye, you see at the middle of it, right at the middle, there is like a white opacity there. And you know, we have had some parents who said they took this child to the hospital and they told them, let the child grow up first. No. You're a mother, you have a baby, and you're seeing that eye is white. It points to the fact that this child has a cataract and this child should be seen, should be taken to the hospital. Now, the other thing, growing up, there's what they call retinopathy of prematurity. A child was born preterm, premature. Glory be to God, the child survived. But that's just the beginning of much more. In fact, it can lead to blindness if they develop a retinopathy of prematurity that wasn't detected. They can have a retinal detachment and it's a permanent blindness for life. Other things that mothers or parents can look out for is you have a child and you see that one eye is deviated. In our own language, we call it squint. That's like the half-past-4 kind of eye. You say, oh, the child is looking at me, but the eyes are turned outward. No, you know, sometimes you hear things like that's how the grandfather was. No.
Can it be corrected?
Yes, it can. It can. So you're a parent and you see your child having that. Please, it points to something. It's probably that one eye is actually not seeing well and it's deviated. You have a child and the eyes are shaking. You know, some they can't fixate. They look and you just see the eyes are shaking. That eye is not seeing well. That child should be brought to the hospital. Now, leaving the very tender children and coming to children who are a little grown. By the time they get to age 2, 3, and you put them, like I had mentioned earlier, you put them in the sitting room and they go straight in front of the TV. That child is not seeing well. Or you have a child, when they start crawling or walking, and the child is learning to walk, and you realize that this child, when the child walks, this child will bump into objects. That child isn't seeing well. So much more, it goes on and on and on. But once a parent is observant, you would actually pick it that this child can see. Or even when the child is a baby, you know, that's what they call developing the social smile. At 3 months, when a mother smiles at a baby, the baby should smile back and all. But as a mother, you're smiling, you're even singing, the baby is not smiling back. You know, the baby...
Following objects.
Yeah, the baby is not following objects. It points to something that child isn't seeing well. It's time to go check the eyes. You know.
We must leave this conversation here. It is truly, it was an insightful time talking about World Sight Day. We've been taught about how to care for our eyes and all. Thank you so much, Dr. Ufoma Olumodiji. She is a consultant ophthalmologist at Luth. Oh, sorry. Lasuth.
Yes.
Thank you so much for your time on the conversation.
You're welcome.
The program continues shortly. Stay with us.